ആദ്യം വരുന്നതായി കാണില്ലായിരിക്കും. ഒരു മിനിറ്റ് വന്നിട്ടില്ലല്ലോ ഇപ്പൊ.
ഇത് സൗണ്ട്
Our speaker is here. Good evening, ma'am. We'll start the session within a few minutes.
Okay, hello, good evening.
We have 44 participants now. Can we start now?
Sure, sir.
Good evening, ladies and gentlemen. A very warm welcome to one and all to this special online session on asthma care for all. I'm your host Anjal, and I'll be guiding you through this informative and engaging event. Today, we have gathered here to discuss an important topic that affects millions of people worldwide: asthma. We have an esteemed speaker, Dr. Jeeva Babu, with us, who will share valuable insights and practical advice to help individuals and families manage this condition effectively. I invite Engineer M. Anil, Secretary of IEEE EdSoc Kerala Chapter, to deliver the welcome speech and give a brief introduction about our speaker. On to you, sir.
Thank you, Anjal. Good evening, all. Especially a warm welcome to our speaker of the evening, Dr. Jeeva Babu. Sorry. In fact, we program this talk, Asthma Care for All, to commemorate the World Asthma Day, which fall on the first Tuesday of May every year. So this time World Asthma Day was on 2nd of May, being the first Tuesday of May. And we have just come out of COVID-19, which had terribly shaken our economy, our health. And so many people have lost their lives in COVID. And then there was accidental burning of waste materials at Brahmapuram that was piled up by Cochin Corporation. It was accidentally burned, and so much of impurities, mainly dioxin and all, must have been produced, and it has its effect in the environment. Like, so what are the possible causes of perhaps then I do not know. Actually, the medical community only knows the increase in death rate or increase in disease contracting as regards the respiratory disorders are concerned in Kochi and its suburbs, and in nearby districts of Trissur, Alapi, etc. Then actually, we know in our high school classes, we have learned about the coordinated system of respiratory system and circulatory system. Actually, we have systemic circulation and pulmonary circulation taking place in our body. And actually, now that way, the circulatory system and respiratory system are very well interconnected. So, causes of heart failure also can be induced with breathing issues, breathing troubles, and even that has to be inquired into by the medical fraternity. So, we have a informative, knowledgeable speaker today, Dr. Jeeva Babu. She holds an MBBS degree from the prestigious Trivandrum Medical College. Then she did her MD in respiratory medicine from SMS Medical College, Jaipur, and she is currently doing her super specialty DM in pulmonary medicine, first year in Amala Medical College, Trissur. In fact, she's one among our family, and we are happy to invite you, doctor, for this session today evening. And I welcome Dr. Jeeva Babu, MBBS MD, Senior Resident in Pulmonary Medicine, Amala Medical College, Trissur, for this session. And I welcome all the members of our SLT and all the participants who have joined for this webinar session. Wish you all a nice, informative journey through this 1 hour or so speech by or class or webinar by our distinguished speaker of the evening. Thank you so much. Over to Anjal.
Thank you, sir, for the warm welcome. Now it's time for the session. On to you, ma'am.
Thank you, Anshul and dear Anil sir. Thank you for the welcoming me. And I think it's time for all of you to hear about about asthma a bit. It's a Sunday evening, and I will not bore you more with asthma. I'll just enlighten you and aware you about the basic risk factors, the basic treatment principles of asthma, and I'll finish probably within 30-40 minutes. So I think we'll start the section. Is the slide visible to all?
Yes, ma'am.
Yes, ma'am.
I think I'll. Yeah, it is visible right now. It is visible, right?
Yes, ma'am. It's visible.
Yeah, okay, fine. Thank you. So, the topic for today's discussion is asthma care for all. Actually, I took the topic from today, this year's World Asthma Day. It holds the same topic, that is asthma care for all. So, let's hear something about asthma today. So, I think all of you must know him. He's a famous player, David Beckham. He's a very professional football player. And the next one is a famous soccer player whose name is Donald Bennett. And here comes our Don Dolan, who is an Olympic medalist, and our famous actor of India, who is Amitabh Bachchan. So, since today's topic is asthma, I guess all of you must have guessed that the one thing common to all of them is that they all are suffering from asthma and still they excel in their own profession. So, that is what I meant to say is asthma is a treatable disease, which I'll explain through my slides today. So, coming to the introduction, the World Asthma Day. I was wondering that why it was on 2nd May. So I searched a bit and came to know that it is in fact celebrated every first Tuesday of May since 1998. And the reason for that is that it coincides with the spring and fall season, which are times when asthma symptoms can worsen due to changes in weather and allergen exposure. I know some of the audience here might suffer from asthma, and the main problem which they all complain is that the symptoms like the allergies, the dust exposure causing allergies, all these are on a different seasonal exposure, like on winter months, or if they are exposed to dust. So actually, it is the reason for choosing the first Tuesday of May, since all over the world, I'll show you the prevalence in the next slide. The spring and fall seasons, in these seasons, the asthma symptoms are increased in most of the populations in the world, and it is the reason for choosing the first Tuesday of May as World Asthma Day. So I was asked to take a seminar on 2nd May, but unfortunately I couldn't. So hence, since currently May is still going on, I thought I deliver a message on asthma before May ending. Okay. So coming to the first topic, that is prevalence of asthma. Let's see how many people are affected in our world with this disease. So this is the prevalence shown in this figure. So we see that this almost see it is actually more than 25 percentage involved countries Australia. Obviously, everybody might have understood this country from the map, and India stands here in this picture, which is around 0 to 10 percentage. So globally, we are at a lesser position compared to the prevalence of asthma. But overall, we see that in the whole world picture, many of the populations are being affected with asthma. So it is a chronic respiratory disease affecting around 1 to 29 percentage of the world population. Now it is a percentage prevalence showing graph. So we see that in China it is 2.1 percentage. In Australia, as I have told you before, it is around 15.1 percentage. America, the Canada, the US are having 10.9 percentage, and the other countries like as such. So let us see the prevalence. So it is the most common chronic disease causing morbidity and mortality in around 241 million people globally. And the prevalence have only increased over the past 30 years. There are many diseases which have caused a decrease in prevalence, but this respiratory diseases like asthma, COPD, etc. have only increase their prevalence in over the past years. So it almost affects around 10% of adult and 15% children. So we see that majority are childhood onset, and the incidence in boys are greater than girls. The reason for this scenario is that the airways in boys, that is in young boys, the airways are very much narrowed compared to girls. And some asthma resolve as they enter adulthood and may recur late. That means even though if a person is having asthma when they were young, it is not mandatory that asthma will continue to the adult. So it is like that if a child is symptomatic, it can disappear when he becomes an adult. Now, let us see the definition of asthma. Actually, first we'll see the normal respiratory tract, and then it will be easy for you people to understand what is asthma. So the how we are breathing. The normally air enters through the nose and it goes through the windpipe and it comes through the windpipe and then it goes to both of the lungs. So it is the normal entry of airflow in any person. Now in asthma, the definition is that it is actually hard to breathe. I made it a simpler sentence that is hard to breathe. The actual definition is asthma is a heterogeneous disease characterized by chronic airway inflammation. Inflammation, I think most of you might understand, but still I'll write it is equal to swelling. It is a swelling of airways. Basically, asthma causes airway swelling, and it is defined by the history of respiratory symptoms such as wheeze, chest tightness, shortness of breath, and cough. This shortness of breath I wrote above as it is hard to breathe. It is hard to breathe. And it can vary over time and intensity together with variable expiratory airflow limitation. All these things are not important. Actually, only this thing is that asthma causes airway swelling. Okay. Now we can see how this asthma develops. So I have included many pictures for you people to understand easily because actually pictures makes it easy to understand for any person, even if it is other professions. So see, I told you before as this air enters the respiratory system through the nose and mouth and it travels through the windpipe. So in the normal person, see it is the normal person airway. The airways have a very big space for air to come in and go out. But in an asthmatic person, what happens is that the muscles of the bronchial tree tighten and thicken and the air passage become inflamed. That is, it becomes swell up and it becomes filled with mucus, making it difficult for air to move. So the asthmatic person airway is actually thickened. See the thickening of the airway. So only small space is there for air to move in and out. It is the reason why an asthma person is having difficulty in breathing. So an asthma person may complain of hard to breathe. This is the basic pathology behind the airway of an asthma person. I guess you have understood. So now these are the same diagrams telling the same things. I just included so to understand it better. So it is the normal lung where the muscles are relaxed, airways normal, but in asthmatic lung there is swollen lining and excess mucus, and also the muscles around the tubules get tightened, due to which that person find it difficult to breathe in and breathe out. So the lung without asthma, muscles are relaxed, normal airways, and amount of mucus is normal. Whereas with asthma, the muscles tighten, airways swell up, and there is mucus clogging the airway, and hence the lung have difficulty to move in and out. Okay. Now let us see, I think you understood the pathophysiology. Now let us see what are the symptoms, causes, etc. of asthma. So the symptoms are mainly cough and especially the cough will be at night. or during exercise, laughing, etc. Difficulty in breathing because the airways are very much narrowed. He may feel chest tightness, shortness of breath is equal to difficulty in breathing, and the wheeze. Wheeze is actually a whistling or squeaky sound in chest when breathing. So the main symptoms are cough, difficulty in breathing, chest tightness, and wheeze. Now, it is another pictorial representation of shortness of breath, difficulty in breathing, dry cough, etc. And the night symptoms are more common in asthma people, and it may worsen on morning. So we see many patients coming to us saying that I have cough more on morning and night times, etc. So we keep asthma as the primary DD for these patients. Next, let us see what are the risk factors and other exposures related to the development of asthma. How can a person develop asthma? So, see, this is another pictorial representation of the risk factors in a nutshell. That is stress, cold air, food like seafood, peanuts, etc., mold, pollution, as Sir was saying about the Brahmapuram incident, and the pollen allergens, the pets like dogs and cat. Now, everyone are having some pets or other in their homes. Infections like mostly viral infections, like Sir mentioned about COVID-19. I shall mention about COVID and asthma in my slides later. And the dust mite. Dust mite is usually seen in our beds, which we sleep every day. And smoking. Smoking is actually a very important and big risk factor for development of asthma. And exercise. See, exercise, I'll tell later, it is not a risk factor, but exercise can induce airway narrowing that I shall explain in my later slides. And some of the medicines. Okay, next. Okay. And so it is the same thing, the pollution, smoking, some bacteria, and the pets, household chemicals and dust. So let us see, so let us see the one by one. How can cold air, so what happens in the cold environment is that there is lowering of humidity and hence the airway dries up, which causes the narrowing of the airways and hence the patient becomes symptomatic. So it is the reason for the cold environment. Now about the allergens. Allergens can be many, like dust mite, the fungi, the bacteria. So the most common allergens which we may not see with our eyes, but which is an important factor for causing asthma is the dust mite. See, most of the people are not aware of it. These things may be seen in our bed linings, which we may not be able to see, and in the curtains. Curtains, many of our curtains we may not wash often. So these places, these dust mites thrive, and these are a risk factor for asthma patients. Now, this pets which we often have. Everyone may not be allergic, but those who have an increased hyper responsiveness to the pet's hairs, dandruffs, etc., those persons get the symptoms of asthma when they are exposed to these pets. Now, actually, the allergic sensitization and allergen exposure is actually an interplay between heritable, susceptible, and allergen exposure. That is, if we look deep into asthma, it is actually the interaction between gene and environment. So, everyone who gets exposed to these allergens may not get asthma. Actually, those person will have increased susceptibility to these allergens. Only those will get uh, symptomatic when they are exposed. So allergen exposure during vulnerable development period increase the risk of development of allergic sensitization in those with a tendency towards atopy. Atopy is equal to allergy. So that is what I was saying. That is, everyone is not allergic, but those who have some allergic familial kind of thing that is in their genes, When those persons get exposed to these risk factors, they have a tendency to get asthma. And the other risk factors includes mold. These are the molds, dampness. The problem with all these things that these molds, dampness, all these things have this fungi, bacteria in them. So these are the pathogens causing asthma in these people. Now the viral infections. In fact, we say that viral infection is the most common cause of asthma among infection. Okay. Now it is another figure showing the risk factors like mold, I already told, dust mites, fragrance. Fragrance like some strong fragrance when a person is exposed, he might feel that difficulty in breathing, hard to breathe, etc. Cigarette smoke, actually, it is very important risk factor, which I will explain in my further slides. Some cleaning chemicals like phenols, and again pets come, dog, cats, etc. And car exhaust fumes, strong smells, etc. Now coming to occupational asthma. So see asthma, often we get a history that a person was not symptomatic when he was small, but he started suffering symptoms when he is like some 30, 35-year-old age. So usually everyone has this preconception that asthma is a childhood disease. So it is not. Asthma can be adult onset. And one of the common cause of an adult onset asthma is the occupational asthma. So as the name indicates, occupational asthma is asthma in workplace and which is often missed. So this asthma in workplace means there is something in that person's workplace which makes him allergic and which makes him symptomatic. So it can be the bakers, the millers, the grain elevator workers, lab workers, and some drug manufacturer, etc., which is causing that person asthma. It may be induced or aggravated by sensitizing agents at workplace. And the most important finding here is symptom remit at weekends, on holidays, and when the patients are away from work. This history we get only in case of an occupational asthma. Now coming to air pollution. Like Anil sir mentioned in the introduction, the recent finding of the Brahmaputra is actually a disturbing fact and yes. So what has happened when there is an acute means when there is a sudden exposure to a massive amount of smoke, the airway lining, as I told you, gets affected, it gets inflamed, and that person will feel hard to breathe. So it is the problem of the air pollution. So early life exposure to pollution increases the risk of development of asthma, and proximity to major roadways increases the risk of early childhood asthma, thought to be attributed to the levels of nitrogen dioxide exposure. Indoor air pollution like open fires, it is a classical example of which we had now the Brahmaputra incident in Kochi. And the use of gas stoves has been associated with increased risk of children developing asthmatic symptoms. The pollutant cause, actually the problem we face here is that the pollutant causes an oxidative injury to airways, airway inflammation, and airway remodeling, increased risk of airway sensitization. Yes, so it is about the air pollution. Now, see the reduction of outdoor air pollutants, we can't do that. It requires a national and local policies. For example, we see that during the Beijing Olympics, there was severe traffic restrictions, followed which there is reduced pollution, and we had seen a fall in asthma OPD patients. Similar thing happened during our COVID. During our COVID, all the worldwide and in India, there was the lockdown happening, and we had seen in our newspapers that after lockdown, the pollution rate came down. So it is important to control pollution, especially in relation to asthma. Now, coming to the biggest and the major risk factor, which is actually completely avoidable. See, everyone can choose not to smoke. So it is an actually avoidable, but it is a major risk factor for asthma. Um, Maternal smoking, secondhand smoke exposure associated with increased childhood asthma. Childhood secondhand smoke exposure increased asthma twofold. And active smoking is estimated to increase incidence of asthma by fourfold in adolescents and young adults. So I shall explain what is this secondhand smoking and this active smoking in my next slide. So, see, I came to know this only during my study time. See, the first hand, and I thought of explaining it here so that you people are also aware and you can avoid it in future. So, first hand smoke is actually that smoke that is inhaled by a smoker. So, in this figure, we see a person smoking. So, when this person smokes, if he inhales this air, it is called a first-hand smoke. Now, what is the second-hand smoke? It is the exhaled by a smoker or released from the end of a burning cigarette. It is otherwise called passive smoking, which means the person who is inhaling this smoke is not actually smoking, but it is by a nearby person. He gets the exposure from a nearby smoking person. So in this case, these two children are the second-hand smokers or passive smokers, and they get the smoke from the father or that person near to them who is smoking. So these people are second-hand smokers, and they get from the smoke that this first person is smoking. Now, what is third hand smoke? Third hand smoke is actually toxic residue that stick to the surface and dust after smoke clears. So what is happening when a person smokes? These the the persons who are nearby are also getting smoke. Other than that, these smoke particles get deposited around the room, around the house, in the curtains, in the carpets, in the sofa, in the tables, everywhere the smoke gets deposited. And when a third person inhales the smoke from this deposited area, it is called third hand smoke. So, see the small baby in the figure who is inhaling these smoke particles which got deposited in the carpet when probably his father might have smoked. So, this third hand smoking is a major risk factor for childhood asthma. So, this I would like to what I would like to highlight here, because many times we may not understand that we are the one causing asthma for our children. Now, coming to the diet. So, diet, I'll just finish it. I'll just tell it for a completion's sake. The studies have shown that the vitamin deficiency can trigger asthma. So, among the vitamin deficiency, the most researched topic is actually vitamin D deficiency. And vitamin D deficiency may increase asthma risk in pregnancy. Vitamin C, E, zinc reduces asthma in children, and the maternal sugar intake increases asthma risk in children. So the thing I would like to say is that have a good diet which is rich in fruits and vegetables. Now let us see the correlation between obesity and asthma. The problem with an obese person is that obese person, see, already he or she is very obese. So he may have this mechanical factor. See, this person is very obese, and this person may find it difficult to breathe, or she may have this dyspnea because of the fat which is deposited in her body. So it is the mechanical forces and the poor diet. She may not be taking the diet rich in the fruits and vegetables. All these fat foods will only increase her obesity, which will only increase her asthma. Now, this oxidative stress, immune dysfunction, impaired metabolism are also there, which I'm not explaining further. See, so let us see this obesity. Obesity. Being overweight or obese is a risk factor for childhood asthma, especially in girls. Obese adults develop more severe asthma. Asthma, the problem with obesity is that it is more difficult to control in overweight or obese patients. And the response to treatment is reduced. It is a very big problem when we treat these obese patients. However, drugs we give, the response which we see in normal persons, we are not getting in obese patients. So it is a difficulty we face too while treating these obese patients, and 2 to 4 times likely to be hospitalized with an asthma exacerbation. Exacerbation means it simply means attack, asthma attack. Now, the maternal obesity and weight gain during pregnancy increase risks in asthma in children. So, yes, it is about obesity and asthma. And as I have mentioned, this abdominal fat may contribute to the shortness of breath. Hence, when we prescribe medications for an obese patient, we include weight reduction in the treatment plan for these asthmatic patients because the weight loss can improve asthma as well as it decreases their medication needs. So I would like to just tell how to be in good weight for every one of you. That is, all of you can calculate your body mass index. That is, I'm sure everyone might be knowing this, but just simply telling to make you aware of it. That is, BMI can be calculated by dividing your weight by height in meter square. So, like an example, if a person is weighing some 52 kilogram, so it is 52 kilogram, and if the person is some 162 centimeter height, so it will be 1.62 the whole square, and it might come to around 19. So in this chart, this 19 is here, so it is actually the normal range. So all of you can calculate your BMI and can know whether you are obese or underweight or see obese class 1, class 2. So the actual range which all of you should be in is 18.5 to 24.9. If you're above it, I would encourage you to correct your weight, of course. Height cannot be corrected. Okay. So now coming to the next risk factor or stress or the exacerbation factor is under the stress. See, what happens when there is stress is that um, it there is increased asthma attacks and emergency visit in anxious and depressive symptoms. It is, see, I may not be able to explain it because in this session, because it involves a lot of medical terms. So just understand this. Stress is also a risk factor for asthma attacks. Now, see, I have discussed this picture before, but now again, I would like to remind you the pathology in asthma because now we have seen all the risk factors like smoking, the fungus allergy, mold, obesity, etc. Now, all these risk factors only causing the swelling of the airways. Swelling of the airways, and hence the problem I told you in the beginning itself, the air is finding it difficult to come in and go out of a person's lung. Whereas in the normal person, the airway is very wide enough, so air can go in and go out easily. Okay. Now, let us see asthma in specific populations, like asthma in pregnancy. So, researchers have found out that the changes in asthma in pregnancy, it is like one third, one third, one third. So 1/3 the asthma will get worse, 1/3 it stays the same, and 1/3 symptoms, surprisingly, symptoms improve when the patient is become pregnant. So so it is like that in pregnancy. So it is like it may improve, deteriorate, or remain unchanged. And the general principles remain unchanged in pregnancy. So it is important to continue the same treatment. Many people thinking that inhaler is bad for baby, they somehow stop by themselves, which is not advised. The patient become pregnant should continue the same treatment even if she is pregnant. And poorly controlled asthma can cause hypertension, diabetes, and complicated labor in mother. In baby, it can cause a premature birth, low birth weight, and etc. Now, so like I mentioned, please continue your inhaler therapy and asthma attacks because it can lead to serious health problems for mother and baby. And see, even if you are on inhalers, breastfeeding may be continued because these inhalers are not going through the milk to the baby, it will only reach your lungs. And of course, you have to avoid smoking and avoid any triggers which can increase your asthma attacks. And like I mentioned, vitamin D have found a positive correlation with asthma and decreased wheeze in child. Next, we can see asthma in athletes. Athletes or the person exercising or it can be termed as exercise-induced asthma. So, see, actually, it is actually exercise-induced airway narrowing, and it is not asthma. But asthma can cause airway narrowing, and hence people may think it is asthma, but it is actually exercise-induced airway narrowing. It can trigger symptoms in some people who already have asthma. So it is like exercise cannot cause asthma. It is only that some exercise may cause airway narrowing. So those persons who are already asthmatic when they exercise and if their airway are narrowed with exercise, they may find a difficulty in breathing. So what is happening when a person with asthma exercises that the hyperventilation, that is when a person is exercising, obviously the air movement will be increased. You will be panting when you exercise, right? So hyperventilation occurs with exercise, dries the airway lining, changing the tonicity of the lining cells and causing release of bronchoconstrictor mediators. It is bronchoconstrictor means the bronchus becomes small. So uh, somehow the hyperventilation caused the bronchus or airway to become small. So when airway becomes small, air cannot go in and come out, which causes airway narrowing. So it is actually no need to avoid exercise. Please don't avoid exercise. Exercise I'll tell later. In fact, it is actually good for health in many other ways. So we can prevent exercise-induced airway narrowing in case like avoid exercising in very cold air and warm up before exercise. Some inhalers which your doctor prescribes can be taken before exercise. Now let's see asthma in children. So, children, I had already mentioned that children, the asthma, actually, we have to avoid exposure to tobacco smoke in pregnancy and the first year of life. Breastfeeding is advised. Then, if the children is at risk of asthma, dampness, visible mold in home environment associated with increased risk of asthma. Also, exposure to outdoor pollutants such as lining near a main road, etc., may increase these asthma attacks in children. Now, a meta-analysis of 18 studies were conducted, and in which they found out that overweight or obesity in children is a risk factor for childhood asthma, especially in girls. Girls, they are telling it is because of some hormonal factors, but anyway, overweight and obesity is risk factor for both boys and girls, more in girls. So I found this picture in Google and I thought of sharing it with you. It is actually the vicious cycle of childhood obesity. See, it all starts with a healthy child only. See, a child is healthy initially, then it is like video games and full of fatty foods, fast foods, and only studies. There is no exercise at all. And then he becomes mild obese. Then uh, then again, this video games, everything comes. then the moderately obese, and ultimately when this again happens, it is like severely obese child, and it becomes a risk factor for asthma, diabetes, etc., depression. And when that person becomes an adult, then it is heart disease, diabetes, then mortality, that death in an obese patient is also increased. So it is better to prevent your obesity or overweight from childhood itself. So now let us say about this asthma and COVID, which is a recent hot topic now. So COVID and asthma has been studied recently. Only after the coming of COVID only we studied interaction between COVID and asthma. So we found out, I mean the researchers found out that people with asthma do not appear to be at increased risk of acquiring COVID. So it is like if you have asthma, you are not at a higher risk of having a corona infection. Next, if you have COVID-19, think that you got COVID infection and you are asthma patient plus you got a COVID infection. Even then, you are not at a higher risk of your COVID becoming severe. So it will just be a normal person having a COVID. Now, it is very important to continue your asthma management. Stopping treatment is potentially dangerous, and COVID vaccine. Next doubt which many of these people ask is that can we take COVID vaccine in asthma? Yes, you can take COVID vaccine even if you're asthmatic. So these detect asthma and treat asthma, I will tell only in a very few words because it is not, it will not make much sense to this the population to which I'm talking. So I'll just tell in a very short way. So it is the detection of asthma, or how can we find if a person is having asthma? Obviously, there is a test called pulmonary function test. It is a PFT. So see, how we can know if a person's lung is healthy? It is by knowing the power of the lung. So, power of the lung can be known by telling the person to blow harder. How much harder can you blow? That much higher the power a person's lung is having. So in this, we have a machine and we give the person a thing to blow into, and we ask that person to blow with your maximum strength. And this monitor will record the graph, and we will be reading the graph, and we will be telling the patient about his power of the lung. It is called pulmonary function test, and we diagnose asthma by this PFT. Plus, we have this allergy test, which is a skin prick test, that is in the skin we do, as well as we take the blood of the patient to find if a person has some allergy to any of the environmental allergens. So basically what I wanted to convey is that we diagnose asthma. Asthma diagnosis mainly by